I'm Dagny Zhu. I'm a cornea cataract refractive surgeon. I practice as medical director of Envision Eye Centers in Rowland Heights, California. And I've been doing premium cataract surgery since I started my practice for about 6 years now. My practice primarily consists of patients who want to be glasses free. And so they know the reputation of my practice, which is to use the best technology there is available today to get them freedom from their spectacles. And we have a good word of mouth reputation because we're able to deliver that with the best technology that continues to improve every day. The ClearView3 IOL is completely different from any of the other IOLs that I use for my patients to achieve spectacle independence. First of all, it does not rely on diffractive technology, so there's not the same splitting of light with concentric rings, and as a result, my patients aren't bothered as much by the halos, glare, starburst. There's always going to be some visual disturbances because it is a lens that offers a full range of vision, but compared to the other IOLs I've seen, it is significantly reduced, and that's because of its unique design. It's a multifocal or bifocal with a clear near and distance zone, as well as a transition zone in between that gives my patients a nice intermediate range. And so they get to enjoy the full range of vision with minimal dysphotopsias and nighttime visual disturbances. So a couple advantages of the ClearView3 in terms of surgical ease and facilitation of IOL selection is the fact that it comes in quarter increments and diopters, so I feel that I can be a little more precise with my targeting. I'm a little bit more able to hit that plano refraction for my patients, which is really important when you're trying to deliver on a premium IOL outcome. I find that it's the IOL that provides the fullest range of vision with the lowest amount of visual disturbances. So again, I think it's an IOL that captures the best of both worlds. I would say the implantation, the most crucial part about implantation is centration. And so it's a little bit different from the other multifocal IOLs out there, which rely on concentric rings, and you need to center the visual axis on that central zone. Here, there's no rings. So what you're trying to do is center that visual axis or the Purkinje images in the center of that transition zone. So you'll see two wedges under the microscope, and I like to rotate the eye and have the patient fixate up on the light so that I can see the two wedges simultaneously, and I know that that is the coaxial plane. And then I can make sure that the Purkinje reflex, which represents the visual axis of the patient, lies right in between those wedges. You don't want it to overlap. At the same time, I like to have it slightly in the distance segment. So you want to keep it in the middle between the near and distance segment, but I like to favor the distance segment a little bit more just to ensure that they have crisp distance vision. So for any surgeon who's interested in trying out the ClearView3, I would say take it slow in the beginning. Do as you would with any other multifocal lens. You want to choose patients who have realistic expectations, healthy, pristine eyes from the front to the back of the eye. I think that what's important is also patient selection. So for this lens in particular, having a slightly larger baseline photopic pupil size is helpful. So for me, for my first few cases, I like to make sure that they were at least 3 millimeters in size in terms of their photopic pupil size so that they can enjoy both the near and the distance because you're better able to capture that within the pupil if it's a larger size. I would also say choose patients with minimal astigmatism. Unfortunately, the lens doesn't come in a toric, but I find that I'm often able to treat even up to 1 diopter of astigmatism with femtoarcuate incisions. So you can still use it in patients with astigmatism, but perhaps use in those patients with minimal astigmatism to start with. I think in order to be a great surgeon or a great refractive cataract surgeon and to serve your very diverse patient population, you have to be well informed and well educated about all the IOL technologies that exist there. I think you should not be afraid to try out new technologies because we're only getting better, we're only moving forward, and it's the only way to better serve our patients and give them better outcomes. So take a chance on the ClearView3, give it a try, and I think you'll be very pleased with what you find.